My name is Jesus Rivera Gonzalez.
I'm Riley Oblecki.
I'm Cheyenne Kiwas.
I'm Isabella Dagneith.
And our presentation is on the increased incidence of mental health issues in contact sport athletes. So the prevalence of this health disparity that we are discussing is that while it's not present in the majority of contact sport athletes, a significant portion of collegiate contact sport athletes do develop some sort of mental condition. Around 30% of college football athletes have strong feelings of depression, which increases when the athletes are injured, as stated by Puzukian in 2022. The impact of this disparity is that it can lead to more mental or behavioral health disparities for the afflicted contact sport athletes. Montero and their group in 2022 found that leaving the mental health conditions of contact sport athletes untreated may lead to the development of multiple severe clinical disorders. The severity of the disparity is that it can lead to additional, or it could also lead to physical health disparities. The mental responses to injuries are essential in determining the health outcomes of athletes, as found by Chang and their group in 2020. To show that the health disparity can be considered a health disparity, there are three comparison points between contact sport athletes and non-athletes. One such comparison is that contact sport athletes have a task that repeatedly requires focus, which, which can be either their training or preparing for any games, which non-athletes typically do not have. An increase in physical activity engagement may lead to a tendency of suppressing emotions, which may lead to more anguish, as found by Rakocevic and their group in earlier this year. Another point of comparison is that contact sport athletes view mental health conditions in a different manner than non-athletes. Athletes who are afflicted by mental health issues have a higher probability of not reporting the issue's existence than non-athletes, as found by Peacock in 2021, which can be due to their view of mental health conditions as a weakness that should not be there, as it will block them from being able to participate in the contact sport of their choosing. Finally, contact sport athletes tend to have more responsibilities than non-athletes, which can be seen through the finding of Storch and their group in 2005, which states that female athletes experience more symptoms of anxiety and depression than male athletes and male and female non-athletes, with examples of the responsibilities being their training and their training and their dedication to the sport of their choosing.
So the health disparity that we chose to focus on has an impact on individuals, families, communities, and the entire fields of behavioral health. Focusing on the individual impact. So without accessing care to neurological health, neurological conditions are going untreated. The 2021 study found that 443 million years of healthy life were lost due to these neurological conditions. Untreated conditions also increase the risk for later life cognitive impairment, since the brain regions that are injured, especially in youth, may never get the chance to properly heal or even develop. And after a traumatic brain injury, individuals may struggle with emotion management, which will lead to struggle socializing and also forming and maintaining relationships all throughout life. The health disparity also leads to prolonged recovery and worsened outcomes, especially when these brain injuries are in youth and not treated until they're prolonged and have even harsh outcomes. Focusing on the impact on families, since access to specialized care is so limited, families often find themselves needing to drop jobs and become full-time caregivers. This leads to financial struggles as well as emotional struggles, since seeking care is a full-time commitment and giving care. So the person who's seeking care is going to be out of their job, and the person giving them care may have limited hours that they're able to work. And levels of stress and burnout are not uncommon in these scenarios, as caregiving is a full-time commitment, and seeing a family member becoming disabled from a neurological condition is extremely mentally draining. Moving on to the community impact. As I previously mentioned, traumatic brain injuries can force people out of jobs, which increases both unemployment and disability rates within a community. This can also affect schools, which may not be equipped with the resources to support students who have undergone a brain injury and now face a neurological disorder. Without understanding the severity of their injury, patients may find themselves visiting local healthcare facilities to try and treat whatever neurological conditions they're facing. And these facilities may not be trained with the proper equipment or neurologists, and risk mistreating the patients. The impact on the behavioral health field. So there's limited access to specialized neurological care, and this forces patients to rely on behavioral health care. Behavioral symptoms caused by brain injury may be similar to those of psychiatric disorders, which can cause ineffective treatment and intervention plan created by behavioral health specialists. Misunderstanding symptoms can further prolong recovery for an individual faced with brain injury and decrease their years of healthy life. So there was also several barriers we found contributing to the observed disparity. And this included cultural barriers, which may be misunderstanding symptoms because of cultural beliefs. So this could be like denying signs of weakness and believing symptoms to be a normal part of aging when really they're all part of a neurological condition. This also includes language barriers. Since there's very limited neurologists, it may be hard to find a specialist who speaks your language or can help you understand exactly what you're going through. Income is another large barrier that shapes a person's ability to afford neurological care, which is typically very expensive due to specialist visits, MRI and CT scans, testing, and medications. And going hand in hand with income, insurance is another large barrier due to the fact that neurologists may not accept all insurances and private services may not accept any insurance at all, which is a big factor in people deciding whether they're going to actually get the care they need or just visit a local healthcare facility to try and treat symptoms, which would just prolong recovery and make for worsened later life outcomes. Lack of education. So typically somebody who lacks education would have lower health literacy, therefore a barrier in accessing care and ignoring early symptoms and not believing them to be a big deal. Location is also another big barrier because where a patient lives can make access to care especially harder, as I found that in rural locations, they lack neurological availability entirely. And even for places with the availability, transportation could be a big issue for patients who may not be able to drive any longer or have a family member that can take them to all their appointments. And lastly, we have implicit bias, where healthcare providers are influenced by prejudice and therefore they're picky with who they'll treat and who they will not treat, and may not see patients based on cultural barriers or any other prejudice they believe in.
Moving on, we'll take a quick moment before our comprehensive plan to just say what CTE is, or chronic traumatic encephalopathy, and its importance and significance to this topic. So CTE develops when an abnormal protein in the brain called tau builds up around the blood vessels in the brain, and it goes especially deep in the grooves on the brain surface, and these clumps also form in nearby support cells. Why CTE is so significant to this is because it is not diagnosable until after death currently, and which means that athletes or anyone with traumatic brain injuries who may have CTE is constantly being misdiagnosed with something else. Meanwhile, it could be chronic traumatic encephalopathy. For our comprehensive plan, though, we have started with 5 different goals, the main being to improve access to high-quality neurological care and mental health for athletes at all levels. So just ensuring that every athlete is getting the care that they absolutely need. Then also earlier and more accurate diagnosis of sport-related neuropsychiatric conditions, which can also go hand in hand with reducing misdiagnosis, as I mentioned before with CTE. So just making sure that we are diagnosing them in a timely manner with any brain injuries, concussion, or disease that we know of. Also supporting advanced biomarkers and clinical diagnostics so that CTE can be diagnosed in life and distinguished from other conditions. We can also work to prevent and mitigate mental health crises and brain diseases due to traumatic brain injuries across the whole contact sport community. One way we can do this is by improving clinical access and by building a tiered concussion and neuropsychiatric care network. So one example would be to establish regional concussion and neurobehavioral centers, and also to designate multidisciplinary clinics in each health region. A good example of this, where it's already being done, is here at the University of South Florida, where we have our own concussion center. So implementing regional concussion centers at every big university, or every university in general, would mean that athletes who do undergo a concussion are able to get care in a timely manner, and they're also able to receive the proper treatment and undergo rehabilitation for their brain injury or concussion without having any issues. We can also make mandatory standardized screening and monitoring, because while there's already concussion protocols in place, there should be baseline cognitive and mental health screenings for all contact sport athletes. So prior to an athlete entering, or prior to the season starting for an athlete's contact sport, making sure that their mental health is up to a specific standard, or that they're in good mental health standings, is important, because when they enter their contact sport, and in the event that they do have a concussion or that they're struggling with other things, we want to make sure that their mental health is in good standing. With this being said, it is also important to have a post-injury protocol, that has an early mental health screening after concussion, especially for those with repetitive brain injury exposures. So, for example, if an athlete does undergo a concussion, bringing them into a concussion center and doing a mental health screening right away, and then periodic mental health screenings throughout the duration of their concussion protocol to determine whether or not when they will be ready to jump back into participation in their contact sport. We can also advocate more for insurance advocacy by requiring concussion management plans and mental health access in schools and professional athletic programs. And we can also encourage professionals and players to reimburse advances in biomarker testing, as we said before, with CTE. Also with multidisciplinary visits and telehealth for concussion and mental health. And looking at our conclusions and implications with this, it is obviously with utmost importance that athletes in contact sports, without a doubt, athletes in contact sports face elevated risks for mental health issues and brain disease from repeated head impacts. And often symptoms are missed or misdiagnosed, delaying the proper care that they need. We can also work towards better access to neurological and mental health services, which would significantly improve early detection and treatment. We can also support emerging biomarkers and which could eventually allow or help to figure out how to diagnose CTE during life. And implementing standardized screening and stronger athletic policies will help to enhance safety and brain injury prevention and misdiagnosis. And finally, protecting athlete brain health is a medical and ethical priority requiring coordinated action. And I'll pass it off to Cheyenne to do our final section.
So while conducting this research, we thought about possible solutions. One of the solutions should be conducting more research on improving the diagnostics of CTE instead of after death, maybe potentially finding a cure or some form of treatment to catch CTE at an earlier stage. So the athlete or any individual that suffers from CTE can receive the proper treatment, and it can lower the range of them dying sooner. Also, looking into other neurological brain surgeries, that would be a very good possible solution to compare different techniques used within the neurological surgeries, so they can apply it to CTEs or any other head injuries. Also, a really big thing is to improve healthcare coverage. A lot of healthcare does not cover neurological surgeries or any form of treatment due to the liabilities and high risk of the insurance losing money. By providing a more sustainable and reliable form of coverage, so athletes or any other person could financially have access to a neurologist or neurological treatment, would help possibly lower the levels of this health disparity. Also, within lower income communities, a lot of the athletes are predominantly from lower to low middle class environments. So by providing more access to healthcare, access to neurologists in those areas would allow those individuals to receive the proper treatment that they need. Another possible solution is informing more safety equipment. In football, normally people wear guardian caps. It's like a padded thing that goes around the helmet, and it provides more cushion and reduces the risk of getting a concussion or any other head injury. Also, for the final possible solution would be promoting and educating patients. By doing this, you are emphasizing to the person that to be vigilant of the symptoms or possible mood swings or anything that could show like CTE at an early stage. Being that CTE does not require, or any type of head injury require consistent doctor visits, being watchful of mood swings and the potential symptoms from that would needs to be pushed more within the education system. Sorry, that was on that slide. Okay, sorry. So similar neurological techniques would be stereotactic brain biopsy. It's when they take a small needle and they collect a tiny sample of the brain. This is their form of testing for tumors. This technique, being that CTE, you do need to collect a brain sample, and that's why normally they can detect it after death. Having this technique and comparing some researches and performing research studies could potentially help form a new form of treatment or a technique to apply for detecting CTE. Also, neuroendoscopy is a small surgical tube with the camera. It's to see on the damaged area or tumors in the brain. This can help. This can help form a technique for CTE, being that it's more closer to the frontal lobe, so they can catch it at an earlier time. So, new study alert in 2024 at Boston University, they started collecting a lot of data of forming a new treatment with CTE. They did this by testing on over 300 donated brains that tested positive for CTE. A lot of them were athletes, and they determined what was the cause of it, what were the proteins involved in it. And this research was a big stepping point when it comes to pushing for more treatments to catch CTE before death. Hopefully, this research can be pushed a bit more and potentially find a cure to this neurological disorder. This all matters because when you're taking two different brain surgery techniques, including in the neurological field, this will be people can push more for better healthcare coverage, better treatments, better techniques, also a better way for diagnosing. A lot of the times it can be misdiagnosed, being that CTE or any other head injury can share similar symptoms to other things. So by pushing all of this, by pushing for more coverage, more people are going to want to seek help and potentially not be in risk of passing earlier on.
And then here are our references. And thank you so much.